This morning I had a patient tell me that she didn't trust the doctor that covered for me, and that she was not the first person that day to say the same thing. Now, this doctor has good adjustment skills, is a great communicator. People really like the doctor. But this person who was covering for me on that day doesn't have confident hands, and the patient feel that they don't trust that. And it's interesting because the same day that these people are telling me this feedback, there's another doctor observing, and this doctor, he's been in practice for I don't know how long, 30 years, something like that, and is struggling in practice. And I asked him for an adjustment, and I could see right away why he doesn't see anybody in practice. There's zero confidence. Even if the person's confident in the way they're adjusting, I didn't feel the confidence in their hands. So let me tell you the difference between a confident adjustment and one that shows the patient that you know what you're doing and that you got it. Results are one part of it, but you have to remember that if somebody's in it for the long term, they're not looking for massive changes on a per visit basis, although that's nice, but they're looking for somebody who knows what they're doing. So the first thing for a person who has a lack of confidence, they always have what I call busy hands. So busy hands are, they come up to the patient and they start to palpate, and their hands are busy, like I'm pushing on the pelvis, and then I push up the spine, and I pop all the way up, and then I wiggle the neck back and forth, or maybe they're on their back, and I wiggle, 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 wiggle. More wiggling, just more wiggling. If you're a wiggler, slow your hands down. Palpate. Find the subluxation. Challenge it. Slow. Slow is confident. I don't mean slow like be a slowpoke. I mean be purposeful. Purposeful. And then the words that you use are so important. Like this doctor, I said to the lady, I says, well, why didn't you think you weren't confident? Because lots of people were sore after he adjusted them, and that's one thing. But sometimes they're sore after I adjust them, and they don't have a lack of confidence in me. And so what she said was this, is that he checked her, and then adjusted her, and then goes, yeah, no, okay, I'm just going to leave that one right there. And that was the conversation. And probably what the doctor was thinking in his head was, is that a subluxation? No, it's not. This person is clear. I'm confident they're clear. But that's not what the patient hears, right? Yeah, no, I'm just going to leave that one right there. I hear it all the time, and I get the adjustment where somebody does an adjustment and then they just stand over you. Super creepy. Like they don't say anything. And so this guy who was observing, he adjusts me afterwards. And so, I'm on a side posture adjustment. He adjusts me and then comes off me and just stands there. And I'm like, so what now? Well, you're done. Well, why don't you say that, right? You have the person in side posture. You just, got it. Power's on. Great. Come on up. Closure. It's just there's a sense of being awkward around it. So the confident adjuster has precision with the adjustment. Number two, they have precision with their palpatory skills, their palpation. The patient feels it. Like when I find a subluxation, not only do I know that I found it, but the patient knows I found it, because they can feel it all the time. They go, oh man, how'd you know that? And they're kind of, how did you know that? And I just tell them, it's a good guess, it's because they know it's not a guess. When you check leg lengths, just bringing them up and down and up and down. I see doctors, they go up, turn your head left, right, up, down, side, side. And I've even had patients go to another doctor who I know is really good, and then they come back and go, they didn't even do anything. They had me turn my head left and right, they didn't even adjust me. The doctor's not even communicating that that's part of the analysis, that when they turned left and right and they were clear of subluxation. The patient thought, is that the treatment? When the patient doesn't know what the heck is going on, they don't have any confidence in you. So if you don't know, videotape your adjustment or ask a confident adjuster for you to check them and see what their feedback is. Let them be honest with you, because the more confidence a patient has in your ability, the more likely they are to get great results, and the more likely they are to I guess, become the patient that you want them to be, which is somebody who gets results, somebody who stays, pays, and refers, right? Confident adjusting. Slow down your hands. Forget the wiggle, wiggle, wiggle.